With the COVID-19 vaccination process underway across the country, there's been some confusion here in Lloydminster about how people are going to be able to get their vaccines and who is going to be administering them. So to get some more information, I'm joined today by Lloydminster MLA Colleen Young. Colleen, thank you so much for taking some time to talk with me today. Starting off, I just want to ask you, which health authority is going to be vaccinating people in Lloydminster, and are they going to be vaccinating the entire city no matter which side of the border they're on?
Well, as you know, SHA is the governing health services department that will be delivering, that does all health services in this community. So they provide it and they deliver health services in this community. So SHA will be the governing health authority to provide and deliver vaccines going forward in this community. As we know, there was one earlier exception where the long-term care residents in levels 3 and 4 in our Alberta facilities here in Lloydminster, AHS did provide the vaccines, but SHA did administer those vaccines to those long-term care residents. And that's because Alberta had vaccines ahead of SHA and had a goal to get those long-term care facilities vaccinated as soon as they possibly could.
All right, so right now, what stage are we in when it comes to the vaccination rollout plan?
We are still in phase 1 for Saskatchewan, so there are still some second doses to be administered to long-term, well, I believe most of our, if not all of our long-term care residents on both sides of the borders have been vaccinated at this point in time, and pretty much all of our healthcare workers. We are now doing second doses for some of those in phase 1 of our healthcare workers and those on the phase 1 list, and have begun vaccinations phase 1 of the 70 plus, working with the descending age and down to 70 on those residents living independently here in Lloydminster, and that is for both Alberta and Saskatchewan residents.
So for those people who are over 70 living on their own in the community, how are they going to be contacted for this? And is the SHA going in alphabetical order, or is it kind of just random?
Well, as we know, Alberta did open an online booking as well as a call-in number, but that is if those residents choose to go outside of the community, travel outside of the community to get the vaccination, they're welcome to go online and book. But they got to remember that if they do that, and whether it's to Wainwright, Camrose, Bonnyville, Elk Point, as I understand it, there are a number of locations they will have to go back there within 21 to 42 days for their second dose as well, because they will have the records for those individuals. But Saskatchewan Health Authority is using calling numbers off of eHealth, which they have gotten from Health Cards and Vital Stats Canada, in order to make calls to residents in the community in order for vaccines. Now, keep in mind, we are limited in the amount of vaccines that we have. So once those vaccines are gone, they will not be calling anymore until more vaccines come.
Here in Saskatchewan, there's no mandatory vaccination, so anyone who gets a call and doesn't want to receive a vaccination doesn't have to get one, right?
It is not mandatory. So if the person says they are not interested in receiving the vaccine, they will just go on to calling the next person on their list.
And for when you get the vaccine, is there anything that you get that proves that, yes, I've been vaccinated?
Yes, you will get a card that that you are to keep and bring again to the next appointment that you have for your second dose when those doses arrive. So
as you mentioned earlier, we're still in the early stages of the vaccine rollout plan. Once we get into other stages and we start vaccinating more age groups in the general public, how will things look here in Lloydminster?
Well, Saskatchewan will be going to an online booking and a call-in number. We are not ready for that at this stage of the game. That was something I was trying to work on last week. I had communication with my counterpart colleague here in Lloydminster, Garth Roswell, the MLA, and for Vermilion, Wainwright, and Lloydminster. And we were on a conference call with AHS and SHA to try to see if that's something that we could accommodate for residents here in Lloydminster. But Unfortunately, SHA is not ready to go to an online booking as well as a call-in number. And we'll be continuing with calling to residents based off the eHealth list that they currently have. HS is also providing them with lists of residents in Lloydminster that they will be using to call. So they are receiving resources from AHS in order to be able to call residents on the Alberta side in Lloydminster as well for those appointments.
The SHA is the one who's administering the vaccinations, but the province is getting the vaccines from the federal government. So can you just talk a little bit about what the process has been like about getting vaccines from the federal government and kind of how that has kind of changed and affected the provincial rollout of the vaccine?
Well, absolutely. Out of the 400,000 vaccines that we require at this stage of the game, we've only been able to do just over 75,000 at this point in time, which is only about 5% of our population that we need to get vaccinated. But I have heard as of this morning that within the next month, we are hoping to get about another 15,000, I believe it is. Coming to the province, actually 95,000 that we're hoping of both Pfizer and Moderna to come within the next month. Based on priority areas and areas where we are still needing to get second doses. Most of our first doses we've been able to get across the province now as of this last week. We were able to get first doses down into our southwest and southeast corner of the provinces where we hadn't yet at this point in time. So, the next batch will be to continue with whatever first doses need to get across our entire province. Make sure that our priority groups have all had their first doses and that the second doses are administered to those who are ready within that 21 to 42 days that need those second doses will happen. And then beginning into the rest of those 70 plus with the descending age order. Hopefully, with the announcement of AstraZeneca, that has been approved now, that more vaccines will come quicker. And those ones, as we understand it, are better for the younger age under the 60s. So hopefully if we are able to get more of those as we move along, that SHA will start to roll those into the next phase of our vaccination.
Thank you so much for taking some time to talk with me today, Colleen.
You're more than welcome, JC.